Sickle cell disease has the unfortunate distinction of having very few adult providers willing, able, and trained to care for patients with the disease. As a result, patients tend to drop off of a cliff when they leave the pediatric sources of care, and go into adult environments of care. Adult sickle cell medical homes are intended to rescue patients from the abyss. There are very few of them, and it is notable when a medical center, especially urban medical centers that have hundreds of patients like ours, makes the decision to invest in patients with sickle cell disease by hiring staff to do things like care coordination, medication management, help with adherence, transportation, help with psychosocial and behavioral needs, in addition to the biological medication and medical management that physicians and nurse practitioners provide. Our medical home at VCU, Virginia Commonwealth University, was able to document in a before and after study that we, by instituting a medical home, were money saving, we were hospital day saving, we were visit saving on the inpatient side. We actually enhanced the number of outpatient visits. The number of emergency department visits stayed about the same. On the whole, we were able to save, in terms of avoided admissions, et cetera, about $2.4 million over a 2-year period instituting this medical home. And we just show those results here. This is not a randomized controlled trial, and I doubt that there will be one of an institutional intervention such as a medical home. But it is very strong supportive evidence. All of the variables that we measure moved in the direction that we hypothesized they would move. We feel like if one were to do randomized controlled trials, you would be trying to figure out what in our intervention, and there were many, many parts of the intervention. What is the active ingredient, or what are the active ingredients that every medical home should have? We're starting to publish about that, but this is raw data that would be useful for the others who are planning to put medical care for sickle cell disease in the front of the bus where it belongs.